Welcome to the Physician Associate Podcast.
Hello and welcome to this episode of the Physician Associate Podcast. My name is James. Today I'm delighted to be joined by Geert van der Brink, who is a Programme Director of a PA course from the Netherlands. Welcome to the show, Geert.
Thank you.
I hope I'm pronouncing your name correctly.
Yes, you are rather doing well. Yeah.
Thank you. Do you want to start the episode just by introducing yourself, telling us a little bit about yourself and as a physician associate in the Netherlands?
Yeah, we call it still physician assistants in the Netherlands. I think physician associate or physician assistant, it's rather hard to pronounce for Dutch-speaking people, and it's even harder to write it correct. And it's also a title in the Netherlands. It's protected. It's in the law, and in the law it's called physician assistant. It was established in 2018. So in change to physician associate, I think it's a little bit better name than physician assistant. Is rather difficult, and the advantage for a change is not very big. We started in the Netherlands in 2002 with the physician assistant. We had a lot of help from the PAs from the US, and we look at the professional profile, and we adapted it, and we make an own curriculum for the PA. We have 5 PA programs, Master of Science programs in the Netherlands. Every year, 250 new students funded by the government. One program cost about more than 100,000 euros because our students get also a salary during the program. It's a dual program, working and learning together. They are going 1 day in a week to the university, 2 days in a week a clinical rotation, and 2 days in a week they work at a place where they hired them as a PA in training. That can be everywhere: GP practice, hospital, rehab clinics, etc. In Nijmegen, we have more than 200 students now. It's combining the first, second, and third years. It's a 2.5-year program.
It struck me when you were talking about the beginnings of the profession in the Netherlands. 2002 was around the same time that they first introduced some physician assistants from America into the UK as well for some trial sites. They brought some PAs over and put them to work in the NHS to see if it was going to be successful. I think the reason behind that was that they were struggling to recruit enough GPs into the NHS. Was it similarly workforce pressures and lack of doctors in the Netherlands that meant that people introduced the PAs?
Yes, that was the initial motive was shortage of physicians, but I think that's not the case anymore. I think we have now more than enough physicians. Some are unemployed, but we think that the physician is not always the right professional to do the task that he is doing. And in a lot of cases, you can do that with a less longer educated person, like a physician assistant. And that's the reason that the PA is rather successful in the Netherlands. We don't have very high figures like you do in the UK. We have now about 2,000 PAs registered in the Netherlands. And they are working at instead of the residents, because the residents, they are more focusing now on their education and not on the production of healthcare. So the production, that was a problem, and PA is working on that now. We have a shortage at this moment on GPs in certain areas and regions in the Netherlands. But overall, there is no shortage anymore of physicians.
Well, that's interesting. It certainly feels different in the NHS. It feels like there are lots of rota gaps and not enough doctors to go round, not enough GPs.
Yeah, but it's also a discussion that we have here. We say that of course, a physician assistant, a lot of the work is a substitution what he's doing, but he's also supplementing something to the healthcare. And the supplementing aspect of the physician assistant is getting more and more important. Because when you are working with a physician assistant and a physician, the physician gets more time to do the complex patients, and the PA can do the less complex patients, and also add additional time or additional care to the patient, and that's a win-win situation, I think.
Sort of a redistribution of the workload amongst people.
Redistribution, sometimes a redesigning of the workforce, and I think that to think better what is the right person, what is the right professional to treat the patient, I think that's a good question.
There's lots of questions firing off in my mind. You mentioned that there are about 2,000 PAs in the Netherlands now. It's roughly, I think, around 3,000 maybe in the UK at the moment. So not so dissimilar. But we are producing maybe about 1,000 qualified PAs every year now. So I guess the numbers will accelerate quite quickly.
Yeah.
And you said that there were 5 courses in the Netherlands?
Yeah, 5 courses and 5 programs in the Netherlands, yeah.
And
they are all Master of Science degree.
And producing about 250 new PAs into the workforce yearly?
With 5 programs, we produce 250 new PAs every year. Not everyone is successful, completed the program. I think every year 220, 230 new PAs we added to the Dutch healthcare.
Question, you used the term resident earlier when talking about hospital medicine, which is an American term to my ears, not something we have in the NHS. Residents and attendings, I think, are similar to registrars and consultants in British hospitals. Could you just explain a little bit about how healthcare is structured across the Netherlands? Is it a public system like the NHS, or is it more of a private healthcare system?
Oh, that's a rather difficult question. No, I think that we combine the NHS and the American system. We have everyone has in the Netherlands has a healthcare insurance. That's mandatory. You pay when you are going to the hospital. You pay every year amount of money as an own risk, your own risk that you have to pay. That's 380 euros. But when you pay that, everything is for free. Also, the GP is for free. And only when the GP is the prescribing medicine or other things in the hospital, then you have to pay for that. The hospitals are getting money from the government and the insurance companies, but that's all regulated. So that's, I think, between the NHS and the system in the US, and the only difference with the US, I think a very important difference is that everyone in the Netherlands is insured for the healthcare, and the amount of money that you earned is not from influences what you are paying. You're paying a fixed amount of money to the insurance. That's also restricted from the government. It's a regulated system. when you are looking to the health spendings in the Netherlands, we are in the top 5 or top 6. And when you are looking at the ranking, and that's very different from which ranking you are looking, but the quality of healthcare is rather good. We have the GP as a very important person in the healthcare, as a gatekeeper. When you want to go to the hospital, only a GP can refer you to the hospital. It's not a free system that you can go to the hospitals. And I think that's the same with the UK. Yeah.
Yes, usually, you have to be referred in from your GP to see a specialist in the hospital, which I guess is unlike the American system, I think, isn't it?
No, they don't have a gatekeeper like that.
No, if your child is sick, you take them immediately to your pediatrician, or
and then you have to pay.
So let's talk about the early days of the PAs in the Netherlands. Was there resistance? Was there upset about introducing physician assistants into the Netherlands, or were they welcomed with open arms?
Of course, there was resistance, of course, and not everyone was very happy with the PA, but there were enough people who were very happy with the PA. So the number of pro people and people who are against is growing. So every year, more people are thinking that the PA is a good development. And I think that's very important that you start with people who think that's a good idea and want to work on that. But we also listen to the opponents, to the people who are not very happy with the PA, and listen to their arguments. Some are very reasonable. You can understand that. Sometimes not, but I think it's very learnable to do that. And I think, of course, you can find people who are against the PA, but now in every hospital there are working PAs. The number of PAs and GPs is growing, and elderly care there is growing. And I think in elderly care and GP practices is a lot of demand for extra PAs in the near future. Also because of the demographic development of the Netherlands.
And you mentioned it's a master's course to become a PA to train.
Master of Science degree, yeah.
So do applicants need an existing undergraduate degree in science?
Yeah, they do need a bachelor degree. A certain bachelor degree in healthcare, and that's the difference with the situation in the UK. In the Netherlands, you need healthcare experience as a nurse or a physiotherapist, and I think in the UK you don't need that. No,
not at the moment. No, a lot of PA courses will take people with other bachelor degrees, science degrees. And sometimes other healthcare experience, perhaps from the army or caring roles. Those kind
I had a discussion. I was once with the start, I think, in 2005 or 2006 in Birmingham with the first PAs who are from the US. And I also had a very nice, a lot of conversation with Jim Pearl, one of the founders, I think, from the PA in the UK. And I think that's a different vision about human resource, because we think that for nurses or physiotherapists, when they can do a master degree, the healthcare as a whole is being more attractive for people to go to work there, because you have a lot of possibilities to learn further, to do a master, etc. And I think that the argument in the UK was that the problem that you recruiting your own personnel and then create a shortage at your own. I think that's a different point of view. I don't know which the best is, but we are happy with this because the healthcare as a whole as a workforce is rather attractive for students. There are a lot of applicants in nursing and in physiotherapy, etc.
Do you have a role such as an advanced nurse practitioner equivalent in the Netherlands?
Yeah, that's a little bit bigger than the PA movement. There are 10 programs, so twice as more than the PA, and they educate also twice as more, so about 500 every year.
Is the scope of the work of a nurse practitioner and a PA quite similar? I would say probably in the UK we're used quite similarly. I work day to day with nurse practitioners and we do largely the same job in the hospital.
I think when you are looking to the work from a PA or nurse practitioner, there are more similarities than differences. But I think the differences are very important because that's the nuance, the accent you have on your working. And we say we have I think a good conversation between two professions. What the best positions are for a nurse practitioner and for a PA. We see a nurse practitioner as a nurse who is extending his or her capacity in medicine and combining nursing and medical care to treat patients. Normally, they treat patients where there is already a medical diagnosis and treatment. How do you say that? Written down by a physician.
Like a management plan?
Yeah, a plan, exact. And when you look into a PA, they are more seeing patients with complaints and have to make their diagnosis and the plan at their own. So that's a different. And for instance, when you are searching for a nurse practitioner or PA in general practice, it's depending on what task you want to let him her do. Is that an overall for all patients? You can better hire a PA, and when it's for instance for fragile elderly people, you can better hire a nurse practitioner.
So to get into PA school in the UK, increasingly there are medical style entrance exams, like exams that medical schools use for their doctors, for medical students, to assess capability and capacity for admissions. We're seeing that now being introduced to the UK physician associate courses as well as a way of entry into the profession. And then it's largely self-funded. So the students themselves pay their tuition fees, which is about 9,000 something pounds a year for both years. Sometimes there are little grants or scholarships that students can attain. It's, you said something like 100,000 euros to train a PA in the Netherlands?
Yeah, but 100,000 euros is funded. So our students pay, and sometimes the employee of the students pay that. They pay, I think, 5,000 euros for the whole program. Wow. But they get a normal salary. So the government pays the employer of the physician assistant in education and training every month 1,875 euros a month for 13 months, so they can pay the PA and training and education a normal salary.
Wow!
So when you was a nurse and you want to become a PA, you can go to the program. And you don't have to have an extra loan or mortgage or something like that. You can go on with your normal life. Only you have to study a lot, but that's the only thing that's changing.
Yes, but you can study because You're not worried about debt. You're not worried about having a second job to pay for your course.
No.
You can focus on studying.
Yeah.
It seems like a much better system. They are thinking of introducing apprenticeship style models for PAs in the UK. So it might be that an employer,
same as we have,
that sponsors somebody through the course, and then you can earn.
Yeah.
You mentioned that the title physician assistant is now protected in law in the Netherlands.
Yeah.
So that, I guess, means you're now a regulated sort of profession?
Yeah, it's a regulated profession. They have a full, how do you say it, practice authority? Is that the correct word? Yeah. They can prescribe medicine. They can diagnose patients. They can do little surgeries, something like that. Only when you're capable for it, of course. When you're not capable and you are doing it, you are having trouble. And also the patient gonna get trouble. But when you are capable, you have the competences to do it, you can do that. So they also, the insurance company don't make a difference when you are treated by a physician or a physician assistant. It's not necessary that the physician sees a patient for billing the services that they are getting. So that's since a couple of years, I think 4 or 5 years. Yeah.
Brilliant. Do PAs come out of their university course as prescribers, or is that something that they have to do?
No, when they have their diploma, they have to register them and they can prescribe medicine.
So in the UK, we are still not regulated as a profession.
I know.
But it is hopefully going to change maybe next year. Fingers crossed.
I think that the parliament has now some time left because they don't have to argue about the Brexit anymore. So maybe they can do real work and establish the PA, I think.
Definitely. It'd be nice to see movement in that direction. Definitely. Yeah. Once we are regulated, we'll then hopefully be able to become prescribers and that kind of thing.
Can you also bill for the activities you do with the patient?
That's an interesting question. We don't really have a billing on the NHS.
Can your hospital? Of course. It's only it's paid by the NHS. It's not production regulated or no.
No, there's no bill to pay for the patient. It's all free at the point of use.
Yep.
Same. There is a charge for prescribed medicines. If you go to collect a prescription from the pharmacy, you'll pay £10 or so towards the cost of the medicine. But otherwise, everything else is pretty much free at point of use.
Yep. Yep.
Once we are regulated with the General Medical Council, once we have that statutory legislative regulation in place, it may then open up to overseas trained PAs coming onto our register to work in the UK, or indeed UK PAs going out into other countries to work abroad. Do you think that would be something that you might see in the future with sort of Dutch PAs coming over to here? Or?
We see it already now, not very much, but there are some PAs from the US, and they get legislated here in the Netherlands. We have a procedure by the Ministry of Health. It's a long procedure. It takes you about a year or so, and when the experience, the competences, etc., are fully the same, then you can work as a PA. The first half year under supervision of another PA, and then you are fully registered as a PA in the Netherlands. And I think we don't have any people who are educated in the UK. But we will judge that also, and so they get a traject, something to do, and then they get regulated. I think for the UK PAs, we have I think extra things to do in pharmacy and prescribing medicine, etc. But that's maybe in 1 year or a half year they can be PAs in the Netherlands. The way around, the Dutch PAs can't work in the UK and the US because they don't recognize the diplomas from other than the US.
Oh, that's interesting. Okay. Further across Europe, is the Netherlands unusual in having physician assistants, or is RPA spreading into neighbouring European countries as well? Do you know?
In Germany, they start a lot of programs with a bachelor degree, and we had a cooperation with Düsseldorf, and they started, I think, this is the first master program PA. And we had a very intense cooperation with Düsseldorf and Nijmegen. So they have now one master PA program, and I think 10 or 15 bachelor PA programs. The scope of practice from the bachelor PA is not the same, I think. So that's but it's I think a good development that they start with PAs in Germany. I saw also that they started with PAs in Switzerland, in Geneva. They already started a couple of years ago with the nurse practitioners. And elsewhere, I think in Bulgaria, there are also some fellows or medical officer kind of people. I don't know really very well. But that's the development, I think, in Europe.
I did a podcast episode with some PAs that are now establishing in New Zealand. And I think she said that there were maybe 11 for the whole country. So it's very small at the moment, but it is lots of different countries are beginning to start PA programs.
Yeah, and also in Africa, in South Africa, and other parts of Africa. Yeah.
I made another episode with one of your PA educator colleagues, Virginia, from the States. And you and Virginia wrote a paper together, didn't you, on the impact that COVID-19 had on PA education across the globe. For anybody who wants to listen to that episode, it should be available on the podcast feed to hear what Virginia said. What impact have you found COVID-19 has had on PAs in the Netherlands, and how did the Netherlands sort of cope with COVID-19? Was it a good response?
I think that's also a very difficult question because I don't know what a good coping of COVID was or is. When you look into Sweden, sometimes you say, okay, they do it very well, and other times I think maybe it's not very well. I don't know. But we just graduated our students who started in September 2020. And they graduated this month. And we call it our COVID cohort because almost 70 or 80% of the time it was online. And there are some strange things. Our university said do everything to give good education. So we bought an online course for medical skills that they can look and train more at home. So we are not getting a budget cutting, but we are asked to spend more money to cope with the consequences of COVID. And I think that's a difference between the US and the Netherlands, because we are a governmental funded university, and we aren't a commercial university. To the students, we have three different kind of education parts. We have our lectures, and our lectures was very easy to do it online. We have a problem-based learning, and we have working groups. And that was difficult because I think when you have a small group teaching in a problem-based learning environment, I think online is not very ideal. And of course, the skills training, they can't do it online. You can prepare them online, but you can't train them online.
Once you're qualified as a physician assistant in the Netherlands, in terms of salary and jobs, is it easy to get a PA job in the Netherlands? And what sort of salary do you get?
Normally, you stay at the employer where you started the PA training. That's the intention. That's also the question. For instance, when a GP wants to hire a PA student, we ask, okay, but the intention that you have is that you hire him or her after he's graduated.
Of course, I keep forgetting about the fact that they're employees when they're students. It's very different to how it is in the UK. So they get it. They are promised a job really before they start training.
Yeah, and therefore it's very hard to get a PA because there are not very lot of PAs who are unemployed. I think we did an alumni research in the Netherlands, and I think more than 95%, no, 95% of the graduated PAs are still working as a PA.
Brilliant.
Yeah.
When I talk to American PAs, they tell me that they can earn different salaries based on which specialty they're in. So perhaps a dermatology PA would earn $80,000 and an emergency department PA would earn $100 and something thousand. In the UK, it's different. It's employed by the National Health Service, so we're all on the same salary up and down the country. Everybody gets paid the same. How does it work in the Netherlands? Is it variable?
No, I think almost the same as in the UK. It's fixed. It's negotiated between the unions and the employees, the employers, and of course, in an individual case, you can give a PA more or less, but there are, how do you say that? It's not a law, but it's recommended salaries for PAs and also nurse practitioners.
Brilliant. Thank you so much, Ed, for explaining all about PAs in the Netherlands. I found it really interesting to see how the professions developed in the Netherlands, and the rate of pace is different to how we're doing it in the UK. If people have listened to our episode of the podcast and want to find out more about PAs in the Netherlands, where would be a good place for them to go to find out more information?
Most of the websites are in Dutch. That's a rather problem because we are now trying to do more in English also. We did some research and we published it in English news or journals. So you can read some of them in journals. And they can send me a mail, or the Dutch Association of PAs is called the NAPA, and you can find there on their site also information. I don't know if they have an English part, but there is an email and that. But you can also, when it's going, when you have a question about the educational things, you can people can write me an email. And when it's more for the profession, please write the NAPA, the Dutch Association of PAs, an email.
Perfect. Thank you. And I'll leave your contact details in the show notes so people can find your contact details there. Thank you so much for joining me.
Thank you, James. It was a nice conversation.
And thanks to you for listening as well. I hope you found it really interesting to find out more about PAs working across the world, and I hope to make more episodes with other PAs in other countries in the future. If you'd like to get in contact with me, I'm on social media at PA Podcast UK, and I hope you'll join me again for the next episode.
Thanks for listening to the Precision Associate Podcast.